Hello, everyone, and thanks for joining us today. We're going to start off. I'm going to do a brief introduction. Our presenter today is Edward Mears. He's going to be presenting on our Strategic Prevention Framework, also known as the SPIF. He's going to be talking about the assessment portion. A little bit about Edward, and I'll let him tell some more. He has previously worked for about 10 years in mental health, and then came to us in the prevention department. So I am going to go ahead and turn things over to him and let him get started with you guys today. Hope you enjoy, and thank you all for joining us.
Okay, well, thanks everyone for joining. My name is Edward Mears, and I'm going to tell you about the assessment portion of the Strategic Prevention Framework today. As Corey said, I am new to the prevention field. I am a certified Missouri Advanced Prevention Specialist. I work for Preferred Family Healthcare, and I am the prevention specialist for Service Area 13, which includes Caldwell, Putnam, Mercer, Harrison, Grundy, Davies, Livingston, and Lynn counties here in north central Missouri. My primary responsibility is to mentor community coalitions in the strategic prevention framework. I have 10 years of working with individuals who suffer from substance use disorders and mental health illnesses before coming over here to the prevention field. And I very much enjoy it over here. And as my supervisor says, over here we save lives by helping keep people from substance use. So with all that, let's go ahead and get started. Some of the objectives that we're going to be aiming for today, understand what an assessment is and why it's so important. We're going to define your community and identify resources and the community's readiness to change. We're going to understand the importance of data, and we're going to create a problem statement. So what is an assessment? The Community Anti-Drug Coalitions of America defines it as a comprehensive description of your target community, however you define your community, and gathering and analyzing data about the community your coalition serves, and identifying and addressing local alcohol, tobacco, and other drug problems. Every community is different. No two places are the same. You can have a neighboring county that is struggling with an addiction problem for heroin and not have that problem in your community. It's just that simple. They're not all the same. And so we want to identify what your community's problem is. So why do you need to do an assessment? You might wonder why it's important to assess substance use reduction needs in your and resources in your community. Especially if you watch the news and see what they talk about, the opioid crisis and fentanyl and heroin, and you may think you already know. So what's the point in doing all this extra work? Well, the simple truth is that problem is not everyone's problem. While it's true our nation is facing an opioid crisis, that doesn't mean that every single community in the United States is facing that crisis. You have to find out what your community's issues are and address those. We can't save the entire nation with one small community. So, a lot of people find the idea of an assessment quite intimidating. Well, you don't realize it, but you are already doing an assessment every day, all the time. When you sit down to pay your bills each month, you have to assess your bank account, your income. Do I have enough money to pay this bill at this time of the month? Is there enough money for all my bills? What do I need to do? You have to take account for everything you have and what you need to do. When you get in your car and you want to go somewhere, you have to assess whether or not you have enough gas or the mechanical condition. Is the car running well? Is there enough seats in the car for everyone who's going? When you get hungry, you have to assess your wallet and make sure you have enough money. Or if you're at home, you need to see if there's enough food in the refrigerator, or if you have a stove, or you have to assess what you're doing. You've mastered this in your personal life. So now we want to master it for our community. The first thing we have to do is we have to define our community. Some people define their community as the county they live in. Some people define it as the town, maybe the neighborhood. Maybe you define your community as you and your neighbor. So, with that, I want to ask you, what do you define your community as? And I'll give you just a minute to go ahead and answer those questions. Okay, so it looks like we got some good answers here. I'm going to show those answers. So somebody said rural. This is a pretty big one. Northeast region of Missouri, a city, a town, a county. In most coalitions, they define their community as a county. That's the typical, but there's no two that are the same. Remember that you can be just your town, or you can be as big as a region or the county. So now that you've defined yours, let's move on to the next important step. We need to define or figure out what kind of resources we have within that defined community. You know, we have people and businesses, law enforcement, healthcare, and parents, school teachers, all kinds of different organizations in the area. We need to decide what we have. You know what's in your area. This is just a very small list. The CADCA, which was the Community Anti-Drug Coalitions of America, recommends these 12 sectors: youth, media, schools, businesses, faith organizations, law enforcement, parents. These are all great resources. This is just a good idea of what is available. So now we know a little bit more about what we have. You know what's in your area. But we have to ask ourselves an important question. Are these organizations willing to help, these teachers, these parents? And in the strategic prevention framework, we talk about the community's readiness to change. And we define it with these 9 phases. The first one being tolerance or no knowledge. Basically, nobody thinks it's a problem, or they just don't even know about it. The next stage would be denial. You know, there's a problem, but nobody thinks it's a problem. You know, it's there, but it's not hurting anybody. Vague awareness. You know, I've heard something about it, but not that much. Pre-planning is there's a recognition that something has to be done, and there are even some people that are talking about it and thinking about doing more. And then in preparation, we've decided, okay, there's a problem. We're going to do something about it. We're going to go to do an event. We're going to raise money, something. 6, we're going to initiate it. We're going to put things in motion and start making a change. 7, we're going to be stabilized. You know, we're going to have a concentrated effort on a regular basis. Level 8, the confirmation or expansion. All right, we've had some success at this issue. Let's expand and see if we can address more issues. And then a high level of community ownership. We have a problem. We are taking care of it. We're not going to let this get away from us. So with that, I want to ask, what stage do you think your community is at on this 1 to 9 scale? I have a poll here for you to answer. Okay, so we have some answers. I'm going to go ahead and broadcast those results. So we have a couple of 3s, a couple of 4s, 5s, and we even have a 7, which is pretty good. It's actually not too uncommon for most communities to be at a level 4, which is a pre-planning, which basically means that there are people working on affecting change, but they could use some more help. So, next thing we have to do, we know our community, we know what resources we have. We need some data. We need information. So the first thing we want to do is remember that there is a lot of data out there. We do not want to get overwhelmed. So don't look at all the numbers. Don't try to digest everything you find. Let's look at these 4 indicators recommended by CADCA to just thin it out and get the information we need. So the average age of onset is the first indicator. That tells you how old people are when they're trying these drugs for the first time. So one example might be the average age of onset for tobacco. and it might say 11.4 or something like that, then that just tells you around 11, 11 and a half as when kids are starting to use tobacco in your community. Remember, we don't want everybody's information, just your community. And then something to compare it to, which would probably be the state. The next one would be past 30-day use. Now, this information tells you how frequently somebody's using it, or basically people that are using it often enough to be considered addicted to it. And then the next one is the perception of risk or harm. This information tells you how, sorry about that. This information tells you how people think that the drugs would affect them. It tells you that they think it's harmful or it's not an issue to them. You know, some people think that marijuana is safe because it's natural, but really it's not, and we know that. So the next one would be perception of parental disapproval of use. This is what people would say that they think their parents think about them using. In a lot of communities, using chewing tobacco in youth is considered normal and not an issue. So that's one issue there. So next we have how we can collect that data, what we can get that information from. And a common one is surveys. There's something called the Missouri Student Survey that has all this information gathered from middle school and high schoolers. That is available for anyone who wants to look it up. You can just do a Google search for Missouri Student Survey and it will guide you to that. And you can pick your county or city or whatever and just narrow it down as much as you possibly can. And that's a really good source. And also you can do interviews, ask the people in your community, do a little focus group and just, see if anyone has any concerns. Local law enforcement usually keeps statistics on arrest records of people for alcohol disturbances and things like that. And observational data is out there. Some of these are more complicated than others. Some of them are fairly simple. All right, so what can you get from the data? Well, before you can address any problem, you need to learn as much as you can about that problem. It's kind of like focusing the lens of a camera. Every time you ask a more detailed question about the problem, it becomes clearer and clearer. So some examples is where is the problem occurring? Who is most affected by it? That just starts to really bring the picture into focus for you. So as you answer these questions, you'll start to see the problem and form that you can take the important step in the strategic prevention framework process, which is called the problem statement. We're going to find out what the problem is and we're going to state it clearly. We're going to write it down so that it's right in front of us. There are usually 6 rules for an effective problem statement just to keep things clear and to the point. The first one is to identify one issue or problem at a time. The next one is to avoid blame. So the problem is young people. They're doing it too much, or the problem is Mexicans. They keep bringing it in. We don't want to do that. Avoid naming specific solutions. Well, if we would just get a teen center, or if we would just spank our kids more often. We don't want to try and solve it. We're trying to state the problem. Define the problem by the behaviors and conditions that affect it. So there's usually not enough of this or too much of something else. Make sure they're specific and measurable and that they reflect any community concerns that have come up. Here are some examples of good problem statements. The percent of youth using tobacco in X county is 23% higher than the state average. It's very measurable, it's to the point. We're not saying how to solve this problem. We're not saying that it's someone's fault. We're just saying here is a problem that it's 23% higher than the state. The number of youth in your community using meth has increased by 8%. That's very detailed. We want to say typically, it's been by 8% in the last year, something like that, but that's a good problem statement. It's measurable. Yay, we have a problem. How about that? Well, maybe not yay, but we found our problem. Now we need to do a little exercise called but why. We know it's a problem. We have a problem. Meth use has increased by 8%. That's a problem we can all agree on. But why is it a problem? And so with that, we want to do a little exercise and try to come up with an idea of why it's a problem. So why would meth use increase in a community? I'm going to give you a minute just to answer that question. Okay, so we have some answers here. Lack of supervision, accessibility, access, increased addiction, cost, availability. Availability seems to be a big one that we can all agree on. So we did a little brainstorming there. We call that the but why exercise. So let's go ahead and see what we come up with. All right, so meth is easy to make. Meth is easy to get. High demand for meth, and meth is not harmful. It doesn't hurt. So now we know why it's a problem. We have a meth problem. Why? Because it's easy to make. Well, it's easy to make everywhere. It's easy to get everywhere. These aren't very specific, right? So we're going to do another exercise that we call but why here. We want to narrow that span down and just focus that camera a little bit more. How about, all right, so but we're going to focus on these two. Meth is easy to make and meth is easy to get. So but why here? Well, for one, dealers are not afraid of being arrested for it. Deals happen on dark streets. Nobody can see what's going on. And the local stores sell items with ephedrine. There's our problem right there. I mean, we know that our local pharmacy sells ephedrine. We know that the police are not arresting people for it. We know that no one can see it because there aren't any streetlights. We can take this information and we can look and see what can we affect on those different options. Can we affect how the police are arresting people? Can we affect the dark streets? Can we make them light somehow? Or what about the local stores selling items with ephedrine? Can we affect that? And different people are going to answer different ways. So this is something you would determine on your own. So what do we have so far? We know what we consider a community. We've defined it. We've found the data. We've looked at it. After reviewing it, we know what our problem is. So we've got a problem statement. We know why it's a problem. And furthermore, we know why it's a problem here. So what do we do with all this information? Can we do anything with that? Yes, we're going to create what is called a logic model. I'm sure most of you have heard of them. They're very helpful in laying down a roadmap of what you need to do in order to affect change. So we're going to start with our problem, and then we're going to start with why it's a problem. We're going to go in and we're going to focus down to why it's a problem here. So I'm just going to go ahead and fill in all that information, the stuff we've already looked at. It's beautiful, nice and clean, very clear. We're not blaming anyone. We're not trying to solve it. Right now, we're just coming up with the problem. So through that, we can tell where we're going to go from here. So let's move on to the next step. Oh, too bad. Sorry. That's all we have for today. So be looking for our next portion of our webinar on evaluation. It'll be coming up pretty quickly. I have some information here for you if you would like to contact us here at Preferred. Contact me specifically if you're in my service area. If not, I'll do everything I can to connect you with someone who can help you. You've gotten some good information here today, and I hope that you take it and use it to make change in your community. Thanks for coming.